Happy Thursday, everyone. Thanks for joining us. Welcome to our October AI in Action webinar. AI in Action, Practical Applications for Safety Net Providers is a monthly Zoom series co-hosted by the Center for Care Innovations and Health AI Partnership and Alliance Chicago, which is dedicated to exploring research and implementation of AI-based solutions that address the unique challenges and opportunities within federally qualified health centers and safety net organizations, promoting equitable access and improved patient outcomes. And this webinar series is also supported by the California Healthcare Foundation. And we are excited about the topic today and our presenters. So let's move to the next slide. Just some quick housekeeping before I introduce our speakers today. If you are not on mute, please mute yourselves during the presentation when you're not speaking. We'll have time later after the presentation for Q&A. And please use the chat box. So while the presentation is happening, please put your questions. We will have one of the presenter team members that will be answering questions along the way. So put those questions as they come up. Please disable any external AI note takers. We are recording, we have slides, we'll have a summary and takeaways that we'll be sharing out in a follow-up email. So please disable those if you have those active. And then lastly, if you have any tech issues, please reach out to Wesley Gabria with his hands up there. He can help you if you need any tech assistance. All right, so today you will hear from our presenters from the California Healthcare Foundation and Culture IQ on what they learned from 16 focus groups and 4 online bulletin boards with patients across the state of California to learn what patients think about AI in healthcare. In a moment, I'm going to pass it over to Stella Tran, who's a Senior Program Investment Officer from the CHCF Innovation Fund, who will share more about why CHCF invested in this work. And then we'll also have a presentation from Michelle Cordoba, the founding director of Culture IQ. And we're also joined by Anna Fernandez Rockwell, also founding director of Culture IQ, who will be managing your questions in the chat. So I'm going to pass the virtual mic over to you, Stella, to get us kicked off.
Thanks, Jessica. So if you're not familiar with the California Healthcare Foundation, we are an independent nonprofit foundation that aims to improve access and quality of care for Californians with low incomes. And I'm on our Innovation Fund team where we're focused on technology as a critical lever of impact. And we've been working to support AI implementation for clinics, public hospitals, plans, and other safety net healthcare delivery organizations. We hear from our stakeholders cautious optimism that AI not only has the potential to address critical issues like administrative burdens and workforce shortages, but also could deliver the promise of supporting patients with population health and whole person care. We also recognize that AI may be a critical part of all technology moving forward and want to help ensure that it can be implemented safely, equitably, and in service of our patients, particularly those who are vulnerable, marginalized, or underserved. Patients and their perspectives will be an important part of how the healthcare delivery system adopts AI. For example, if we implement voice AI to support scheduling, but patients don't pick up or engage because they're scared of how the audio will be recorded or used, or because of how they use AI themselves or what they hear about AI in the news, we won't be able to unlock the full potential of that tool. As we educate our patients or request consent, we have the opportunity to build trust. And when we build that trust, we have the opportunity to improve both patient and provider engagement and to realize the full impact and ROI of the tools that we invest in. So I'm so excited to share with you the results of our listening work, to hear from patients across California. And I hope that it supports your own work in this space and to catalyze discussion and more efforts to hear from patients. And so with that, I'll hand it to Michelle Cordoba, our partners at Culture IQ, to share the results of this work.
Thanks, Stella. Next slide, please. So The last year, CHCF undertook a survey asking Californians across all sorts of different demographics how they felt, how comfortable they felt with the use of AI in healthcare specifically. And they found that more than half of them were not very or not at all comfortable with AI in healthcare, with the exception of Asian Californians. And so we wanted to gather some deeper insights and kind of find out why, what was the awareness level and what were the perceptions. So we took a deep dive into these key constituencies across California to find out what they knew about AI in general, what they knew about AI in healthcare, like what kind of healthcare applications did they know about and were comfortable with. What they might be comfortable using in the future or what would make them more comfortable, um, and what kind of protections might they want to see. Next slide. So we did a mixed mode research design because we were trying to talk to people from a lot of different backgrounds and experiences. And we wanted to kind of, I know you hear this expression a lot, but in research and in other areas, but we wanted to meet them where they are, right? So we did some online focus groups. We did some online bulletin boards in April and May. And we used the online bulletin boards for younger respondents who prefer to interact digitally, and the focus groups among older and non-English speaking participants. We talked to a total of 172 respondents across these categories. And we screened them to be over 18, and they had been to either a doctor or another healthcare professional at least once in the past year. Next slide. So just one little note about qualitative research. This is not a survey, so it's not projectable to the population at large. What qualitative research does is it gives us insights into how people are thinking and feeling, and it helps us identify, we call it directional research. So it helps us identify directions in kind of public sentiment. And so we don't want to take the findings as absolute, but it does give us an idea of where people are leaning, where they're thinking, and it does give us an opportunity to take a really deep dive into some of those feelings and beliefs. We did specific subgroups, so we don't want to say that the findings apply necessarily to any other subgroup. But again, we do take it directionally, and it gives us a good idea of what a large swath of the population is thinking at any one point in time. Okay, so the key takeaways of the study, and we're going to go through some of the key findings, but what we took away from it was that there is a kind of not a conflict, but there is a lot of potential. I think Stella called it cautious optimism. There's a lot of potential from a patient point of view about AI, right? But there's also a lot of questions, concerns, doubts, and fears. So the people that we spoke to, consumers, patients, and their families, want to understand how this AI is being used. They want transparency. They want control so that they can trust these applications. They want human connection to still remain central to the healthcare process, right? It is very important to almost everyone that we spoke to that they have a connection with their doctor, and a lot of perception that AI is going to erode that connection. Cultural and racial context matters. We saw a lot of differences, some significant differences across cultural backgrounds, across language, in how they perceived AI applications and how they felt about them. The digital divide also affects it. Obviously, older people have less experience with AI, or the older people who have less experience with AI were the least likely to be adapters, which we see in a lot of other instances as well. And the administrative applications of AI received the most support. That is the things that Stella mentioned earlier, that would help the process, would help the patient, would help the doctor, things that would, help with paperwork, and the things that had more direct medical applications were it took a lot longer to explain and a lot longer to, there was a few more barriers to adaptation and acceptance of those. Okay, so we'll start with some of the detailed findings. I'm going to try to create a little story for you so that you kind of understand where our patients were when we started, right? So we asked them about AI. And you'll see on the right-hand side of the slides, these are some verbatims directly from our participants in the groups or the bulletin boards and things that they said, and it helps kind of understand where they're coming from, right? So some had most had some familiarity with AI. They'd heard the term. Some of them had used it, but it was a really rudimentary usage. If they said, someone said, I know there are two levels of AI. There's the Siri and Alexa, and there's Chat GPT. Like that's kind of the range of what a lot of people understood was AI, right? They had, a lot of them had used it at work or school or social media. A lot of them had used Chat GPT. We heard, the word research come up a lot. Oh, yes, I've used it for research. And as I mentioned, older adults, respondents with lower incomes, and non-English speakers had the lowest awareness of what specifically AI was. And a lot of people said, oh, I've heard more about AI lately on like TV, or I've seen it in the news, or I've seen it in movies. Next slide. So we asked them, well, what does AI mean to you? And what we got was, a large, kind of varied definitions, a lot about technology, but really that AI helps people perform tasks. But we also got a lot of robots doing jobs of humans, and we heard robots a lot. So you'll hear a little bit later on how people kind of assign to AI this kind of robotic function. Some of them said it was scary or dangerous. Others said, it was beneficial. It helped with research. It provided information. But mostly, again, it was that AI performs tasks for humans. People saw a kind of a balance, and we've been asked, was it a 50-50 balance? For some people, it was 50-50. For some people, it was a little more on the positive side, and for some people, it was a little more on the negative side. But for the most part, the value that they saw in AI, again, in general, was that it was a valuable source of information. You could summarize and synthesize large amounts of data. You could generate content like emails and reports for school or work, and that common tasks were more efficient when you used an AI tool. But the concerns, on the other hand, were people's jobs would be eliminated. There would be biases, kind of like the garbage in, garbage out, like who's creating the AI tools and what biases are they creating them with. A lot of people said, a robot is never going to be able to replace a human. You need human real life experiences to process information, to reason, to make the right decisions. And then at the same time that this AI could be asked to that the AI could surpass human capabilities and potentially replace them, but it would be an inferior replacement because of this reason that adult humans have, right? So thank you. Next slide. So when we ask people about AI in healthcare specifically, I'm sorry. We in terms of their healthcare, these are people who had insurance either through Medi-Cal, Covered California, Medicare. People used community clinics. They were using the healthcare system regularly. They all talked about the personal relationship they had with their doctor. And especially among non-English speakers, that is our Spanish and Chinese speakers, in-person communication and a shared language was really important, not only to rapport and feeling more comfortable, but also being able to communicate what was going on with them. And so kind of everyone stressed to us that it was really important to have trust and familiarity with a doctor, for a doctor to know your medical history. These were important things for patients, kind of going into this conversation about AI in healthcare. And then when it comes to trust, most people said that when the doctor was empathetic, when the doctor was attentive, or doctor or other healthcare provider, when they were knowledgeable and up to date, they tended to trust them more. And when they were dismissive, or when there was a lack of transparency around even billing and charges, not just their diagnosis, that they tended to have a lot of distrust. We did hear a lot of organic distrust of profit-driven insurers and hospitals. It didn't tend to hit the doctor level, but it did bleed into that relationship if they felt that they were being told one thing at a doctor's office and then being charged something else. And among African American respondents in particular, a lot of our African American respondents told us that they personally or members of their family had dealt with dismissive doctors, had dealt with apathetic providers, and that was particularly concerning and eroded their trust in the system altogether. And that was kind of fundamental to their experience of AI later on in the study. So in terms of awareness of AI in the healthcare space, some people had heard of some things either through personal experience or through hearing about it on the news. A lot of people had experienced like an automated phone system. They had heard that AI could help with early cancer detection. Some people talked about trying on glasses and using AI to be able to do that virtually, and robotic surgery. Several people had mentioned that they'd heard that robots were doing surgery and that they were much more effective. It was much more precise, and that they were working into kind of integrating robot surgery into the medical, into the surgical care. In terms of actual experience, like not what they'd heard, but what they'd lived, some people had seen laptops and tablets being used at their doctor visits, and several mentioned AI being used to help interpret mammography results. So that was something that they had either seen or had done when they had been to the doctor. So when we talked to them about AI in general, again, we had the same kind of cautious optimism. So there was a yes and, right? So there was, yes, this might improve our healthcare outcomes. It might lead to more accurate diagnoses, more precise surgeries, potentially better customer service. And even if all of those things happen, AI should be used as a tool to help doctors along, not to replace any kind of human interaction with the doctor, right? Or any experience that the doctor might have. Other concerns were about data privacy and security. This is again in general, you'll see specifically, we got into that a lot. This loss of genuine human interaction with providers, and a potential for it to eventually for doctors to become so over reliant on the technology that they either fell out of good practice or they just didn't stop caring about they would stop caring about their patients. And then there was some uncertainty and apprehension about whether AI was already being used and they just didn't know it. A lot of people said, well, now that we're talking about all this, I'm sure they're using it. I just don't know. And that makes me uncomfortable. Okay, next slide. Thank you. This is the vignettes. So we presented 6 healthcare vignettes to respondents. Interpretation services, scribing, AI-powered screenings, AI front desk and triage, prior authorization, and predictive and analytics. And we gave them a little, we showed them, the little picture, we gave them a description. And next slide, please. And we asked them about each one of them individually. Some of them are current applications, some of them are potential future ones, and we talked about them. despite this little kind of the visual and the brief explanation, we had to explain in detail most of these scenarios before they were really able to understand. And even then, not all of them got it. And this is, what people wanted to know was how it worked, what the robot did, right? And how the doctor was involved. So in their minds, there's a robot doing something, and they want to know where that robot exists next to their medical professional. And so we had to kind of really explain in detail what the application did, and how it kind of coexisted alongside the work that that they understand the doctor to be doing. And again, I'm sorry, go back one more. Thanks. We had this immediate positive reaction, like, wow, this is really kind of cool. But also at the same time, and living next to that was a strong skepticism and suspicion that somehow this innovation was going to hurt them in some way. It was going to screw them. It could be used by the system to disadvantage them in some way. So there was this potential benefit, but at the same time, this fear of a disadvantage. So overall, to all six of the scenarios, and we rotated the scenarios to so that to avoid bias. But overall, the positive reactions were that they could improve efficiency and accuracy of medical visits and records. This was really important to people, especially people who don't speak English. Or who prefer to speak a language other than English, because the medical record for a lot of people is really important, not only for accuracy of diagnosis, but also so that they can go back and kind of understand what happened because in the moment they're trying to get as much information out as possible. So kind of understanding the patient mindset in that moment, especially a non-English speaking patient, with potentially a doctor that doesn't speak their native language or their preferred language, the accuracy of records and being able to have a record of that visit was actually quite a benefit. They perceived that some of these applications could reduce human error and improve the accuracy of diagnosis and treatment. A lot of them said, doctors get tired, their eyes get tired. At the end of the day, things are hard. So if they have someone, if they have a tool that can help them in the interpretation of data or to process information, that might help them. Some of the applications people felt would allow doctors to focus more on patients during visits, and that would lead to a deeper connection between the patient and the doctor. They also felt that it could reduce patient wait times and include like making the appointment more efficient without losing time with your doctor was really important, that they could spend more quality time with the doctor with some of those tools, and that was highly valuable to them. Translation tools would allow patients to speak more freely, reduce the risk of misunderstandings and miscommunications that could lead to misdiagnosis or something worse. The administrative tools could streamline, some of these complex processes, like prior authorization, and that could lead to positive outcome for patients, and that potentially sorry. Potentially there could be a cost savings to some of these, and that cost savings could be passed on to patients. Those were the positive reactions. We'll move on to the negative ones. So again, some of them you'll see are the exact opposite of the positive, right? So there were fears about data security, privacy, and HIPAA. So what are you doing with, for example, in scribing, right? What are you doing with the transcription? Where is it going? A lot of people still had in their mind that their medical file was a pile of papers, and that they were being stored somewhere. And where was that, who had access to that information? Like all of this information that's being collected on you, whether it's digital information or hard information, kind of where is it going? Who's seeing it? Again, kind of like what is the interaction that the robot has with my information, and how do I keep my information, not being shared with other people. There was apprehension about potential for misdiagnosis or errors in treatment if you let the robot or the AI application or the tool do diagnosis without having doctor oversight. Again, the risk that doctors would become overly reliant and less engaged with patients. Then there was a concern about the development and implementation of the tools. I mean, some people question, well, who developed the tools? Is it the insurance companies? Is it doctors? Is there bias? Are there biases? So the same kind of things that we saw, the concerns about AI in general, kind of exponentially, it got larger thinking about, what it could mean to my own kind of my own medical history and my own medical experiences. So would some of those inaccuracies or those biases affect me medically? The concerns with the translation tools, as much as they were perceived as being something amazing to have, a better communication with your doctor, there were concerns about the inability of translation tools to capture the nuances of a language, like informal speech or nonverbal cues or regional dialects or cultural context. So a lot of people had experience with like Google Translate, and it's not that great. And so, with this, what kind of accuracy and professionalism would there be? Um, that was kind of a concern. There was a frustration with current automated systems, and so people were saying, well, if it's hard enough for me to get through now, if there's an emergency and I can't talk to a human, that's going to be stressful. That like the fact that it was a health related situation made it even worse. In terms of being frustrated with an automated system and thinking that they were just going to get relegated to automation and not be able to talk to a human being. This was magnified among non-English speakers or people who preferred a language other than English, who really wanted that human interaction. And then again, the other side of the coin to well, there might be cost savings or there may be time savings. Some people thought that, any cost savings was just going to enrich insurance companies and the patient was going to end up with a lower quality of care. So after we got the kind of input from all six of the scenarios, we asked people, well, what would, kind of in a vacuum, if you ran the world, what would make it better for you, right? What would make you feel better about the technology that would, that you could take the benefits, but not have those concerns or those fears. And what we heard was they wanted human oversight, auditing, testing, reporting. So they wanted to know that somebody wasn't like running an algorithm and then just never coming back to it, right? So if it was diagnostic and people were looking at mammograms, they wanted to know, how many cases in any given week, month, year were they finding something that a doctor alone couldn't find. Reports of that kind of thing, and what was the medical oversight. They wanted to know that that security measures, data privacy measures, data handling policies were being implemented and that were being communicated to people so that it was transparent that whatever additional data they were collecting, they were taking care to go that extra mile to make sure that data was secure, and that their privacy was secure, right? And then ensuring that so informed consent came up a lot, ensuring that patients knew when AI was being used and they were given the opportunity to opt in or opt out. Now we asked them, well, would you, if you were told, would you opt out? And most people said not necessarily, right? But I want to know that I want to know that it's being used, and I want to know that if I don't want to do this, I don't have to. So it was kind of the comfort level was more about the informed than it was about the consent, but they saw them as going together. They said as long as they knew that there was continued involvement of medical professionals in any system or process that was using an AI tool, they would feel more comfortable. So again, not letting the tool run on its own without some kind of oversight. They also wanted to know that that if there were grievances or issues, especially like around prior authorization, that if they had an issue with how the AI, reacted or the answer that they got using an AI tool, where could they go? I think that the feeling was that, they didn't want it to turn into some, huge bureaucracy, that there weren't any people that they could go to. And then there was a concern about making sure the technology, if it was available, that it was available to everyone, that there was some equity there, that not only, certain hospitals or certain practices or people with certain kinds of insurance could use the technology, but that everyone would be available, would have access to a potentially beneficial technology. So we, after kind of listening to what all these groups said and listening to their concerns, um, what we determined was that really there's several key things that we need to think about when trying to increase the acceptance of AI applications in healthcare, and kind of getting patient buy-in. And the first one is patient education. So, no matter how familiar these respondents were with the general concept of AI, they really had a hard time understanding how these AI applications worked in real life. Right? How the doctor interacts with the technology and how the patient can benefit from it. Those were the two things they wanted to know most of all. And so one of the recommendations that we had was to create patient education materials. And that could be depending on your patient base, right? It could be something, as similar as, as simple as, videos or interactive videos in the office, which, exist now, that, there's different videos and information, in different specialty offices, with, or interactive tools. You have some question and answer or brochures, especially graphic brochures, kind of like the ones that we develop, but something with more, a little bit more detail, emails, things that would feature AI tools being used in settings that were familiar to patients. And then a thorough explanation of how it works and how it empowers providers. So if we kind of use language that shows how the doctors are helped by the technology as opposed to being replaced by the technology, I think we would get a much better acceptance level from the get-go. Where, pointing out where the oversight is and emphasizing what the patient benefit is, either they save time or they get better results. Those kind of things would really go a long way. Not only for the patient to understand, this is what the technology is doing, it's helping your doctor, and that helps you. And then building trust. We heard a lot across all of the groups, across ages, across cultural and ethnic background, that they have a vision of healthcare that is very much human-centered, right? That the provider and the patient have a strong personal connection, and that their interactions are, are positive because of that, that trust that comes from having that personal connection, right? So the AI applications that they embraced most, or that were easier for them to accept, were ones um, that simplified administrative work, that provided translation, that speeded up insurance hurdles, right? They served very practical needs that they could see these are practical things that would help my doctor, right? And the concerns that people had in terms of trusting AI weren't necessarily about the tool itself. but it was about misuse or depersonalization or lack of transparency, right? So from a communication standpoint, what we really want to make sure that we're doing to build trust is to talk about the human benefits, right? So how these tools support that like going in, you know, going in with the understanding that we value the doctor-patient relationship, right? The provider-patient relationship, and that we want to help the physicians, the techs, do their job better. We want to help patients spend more time with the doctor and less time waiting, right? And we want to help improve your health outcomes, right? And that kind of starting from the same place they're at would really help go a long way in building trust around these tools that people, don't know enough about, and trigger some trust issues that they already had. Next slide. And again, going back to that informed consent, they want to be informed when AI is in use, right? And kind of be assured of what's going on with data protection and data privacy. They want to be able to opt out, even though they would probably not exercise that option. We asked them, would you want to be informed ahead of time or at the visit or during the visit? And most people said it didn't really matter. They just wanted to know, right? So if it was something that they read about in the waiting room, or if it was something that was sent to them prior to their appointment, that didn't really, impact how they felt about it. They just wanted to know. And again, they wanted this option. And this was, again, in a perfect world. So it may not always be practical or applicable to provide informed consent for AI. We do recommend that when you are able to do that, to have an opt-out feature or a paragraph describing what the process might be if you were really feeling strongly about it, and addressing data security, data privacy, and oversight when you're talking about the description or the demo of the AI tool would be really helpful in kind of addressing those issues before they become an issue, right? So a lot of people, told us, well, if we just knew, then we wouldn't feel as bad about it. Okay, and then cultural and demographic considerations. Next slide. So with the Asian American Pacific Islander population specifically, we heard a lot about respect and family-centered care. A lot of people talked about that they had to either navigate the healthcare system for themselves or for their parents, their aunts and uncles that didn't speak English as well. And feelings that either they or their family members felt of shame or discomfort during appointments if they couldn't communicate well enough, or if they couldn't make themselves understood. And several people said they really needed to feel seen by practitioners and by the system. And so, kind of understanding where they're coming from and what the kind of particular issues that they have around what they see as optimal care, and then the kind of where they see themselves not necessarily able to access that care, is really important to understanding where our Asian American respondents might be feeling about AI. They tended to perceive the AI tools that provided in language support, the scribing, the transcription, the translation, as ways to increase inclusivity, dignity, and independence within the system. But they did have significant concerns about the ability of those language programs to capture kind of regional dialects and the tone and cultural sensitivities. So when those are being introduced, it's really important to make sure, A, that they are as effective as they can be, and B, that we tell them. Next slide. Among Hispanic Latino participants, there was a very similar desire for empathy and connection. These respondents preferred in-person visits continuity with a trusted provider. A lot of people said, if I can't go to my doctor, I won't go. I'll wait until that doctor is available. They talked about experiencing a lot of difficulties navigating the healthcare system with referrals and authorizations. And even if they had Medi-Cal or Medicare coverage or other insurance coverage, they did have high concerns about costs. So they were very aware of what things cost. Among Spanish speakers, interpreters were seen as essential. A lot of them were kind of relying on the nurse or an assistant at the doctor's office to kind of to be grabbed during a session if they were on their lunch hour, or they would have to wait for them to come back. So there had been some negative experience, and the concern about being misunderstood really caused people concern, or not, they didn't want to ask a lot of questions, and they didn't want to press the doctor, right? These things happened or tended to be expressed more among older and lower income respondents in both the Asian American and Latino Hispanic groups. Next slide. And then lastly, our African American respondents had very strong feelings about failures that they had experienced in the healthcare system, either themselves or their family members. They felt that they had not been listened to, they had been dismissed, they'd been misdiagnosed or gone undiagnosed. They'd had a lot of negative experiences with the system, so they tended to be even more skeptical about new systems or tools, feeling that they would just magnify the biases that are already existing in the system. And so we really feel that it's important to take these cultural nuances and the needs of each of these groups into consideration when we're developing communications materials, because we want to respond to the emotional triggers that cause them to have the mistrust, right? And we want to also reinforce the things that they value most, which is this human, connection between a provider and a patient. Next slide. And then we had, and this is the last one, I believe. We did see some differences around age and income. The less technologically savvy they were, the less comfortable they were with AI tools, and the older and lower income respondents were the least technologically savvy. And a lot of people felt that there was, the older respondents felt that they were kind of being left behind. And so they wanted this reassurance that the technology wasn't going to just, destroy them on its way into the future. And so, potentially offering, tech classes or materials promoting digital literacy along with information about AI would be helpful to this particular group of patients. And I think that's it.
Thank you so much, Michelle, Culture IQ, Anna, Stella. I know that Thomas couldn't be here, but wow, what an amazing presentation and insight on really having a better understanding of AI more generally, but also like what are the things that we who are perhaps in those spaces of making decisions around the adoption and rollout of the technologies that this is really helping us to inform. And so I know that we're going into Q&A. I did want to say thank you so much for everyone who shared questions. And one thing I did want to highlight from the presentation was this idea around the patient for continuous QA, quality assurance and quality control, informed consent, the access to the technology, but more importantly, access to a human. So that seemed to be something that really resonated. And I wanted to ask this particular question along starting with the last point. How do we responsibly communicate AI benefits to patients, families, and caregivers in a way that feels real and tangible? And you provided some ideas, but I wonder, could you go a little bit deeper? Like it's saying like how either a patient or provider, but I wonder, what can you share with the audience on what might be those things that can be shared or could be shared given this insight?
Well, I mean, it depends on the tool, right? But I think it's really important to to explain, like we thought when we went into this, and Stella can talk about this a little bit too. We thought, oh, we have these great little these great little pictures and animations, and we have this nice description that was very carefully wordsmithed, and we thought that was going to be enough. That was not enough. Right. So, we kind of taking a big step back and trying to understand what your target, and each provider is going to have a different group of constituents, right, that they need to deal with where they are, but understanding maybe where the patient group is, will help know what tools you need to explain, right? So if it's a non-English speaking or a language other than English preferred audience, then you're going to need to do graphics, right? Videos or something interactive that literally shows the tool and the doctor working together, right? You just have to explain it in a way that's going to make sense to the person receiving the information. What we did, I think one of the findings was we made it make sense to us. And what we learned was that we are not the audience, right? And so it was really important to make it make sense to them, and understanding what as I said, what their triggers are, what their concerns are, and what they value on a positive level, I think can really help. Those are the two levers that's going to help you make your communications, your educational material, the type of material that you decide to make, even if it's just a letter, right, that you send out to your patients in your practice. Hey, we want to let you know about this new thing that we're doing, right? If you explain it in a way that they understand how the doctor is using the tool rather than the tool using the doctor, right? And if you explain it in a way that that they feel like it's a benefit to them and that addresses the fears, then it's I think just gonna go down a lot easier. The fear of the unknown is one of the hugest barriers, right? So any information is better than no information.
I think it's still really early days. And so I think we have the opportunity to test what messages or formats best work for our patients. And that's going to vary across age, digital access, geography, all of that. I really liked Michelle's point around framing in the ways that we understand. And so as an example, I was really surprised by how the respondents responded to ambient scribing, which I think is something that as practitioners in this space were like, oh, that totally makes sense. But that's where they had a ton of questions, and we're going back and forth on how to describe the technology. And so I think there's an opportunity in patient education when we're doing patient consent to have that conversation so that patients actually engage more in the tools that we're using.
That's really helpful. And I think I did take that away as well from this presentation. It's thinking about the themes were like the technology itself more broadly, like general education around technology and specifically around AI, and then thinking about how operational slash patient assistance, like thinking about like what are those points of interaction that your consumer, your patient is going to have, and then thinking about the point of care or point of service, because those are different things in different places, but we're seeing that AI is being adopted in those different ways. I wanted to ask a quick follow-up and maybe just, and I'm going to get to the questions that were posed but weren't answered yet. What are your thoughts around, let's say, like consumer boards or things where you're bringing in patients to get some insight on what communication might work best? Is that something that you've either seen, or what thoughts you might have, again, like putting things into practice where maybe it's part of the process that organizations already have in place?
I think if there's an existing consumer advisory board, it's a great opportunity to engage them in this process. I do know too that for systems that might be more under-resourced, that it might be a challenge to engage consumers at this scale. So I think I saw in the comments about this idea around like, could we have a clearinghouse of patient engagement materials that we share all together and test across different communities? And so, looking for opportunities to scale that. I think if we have that function, we should totally engage the consumers that are already at the table. And I'm also holding that we're in a new under-resourced environment, and to add holding both, how do we listen to patients and the burden to providers who are already challenged at this time?
I'm going to ask a question here from the audience. Curious if you asked about overall trust in healthcare in addition to AI during the survey.
Yeah, we did. We asked people, how they felt, how they were using the healthcare system, and the trust issues came up kind of organically, particularly among African American respondents. But it was kind of like, as they said, I don't trust this AI tool. They were telling us about why they didn't trust the system altogether, and the pain points around trust. I think we went over them a little bit in the presentation, were about there being a system that's kind of out to get them, right? And is not patient centered potentially, and is profit centered. And so that there was trust issues there. There were language issues that weren't necessarily trust issues, but they created trust issues because there was like, am I making myself understood, and am I understanding the doctor? And then there were systemic issues around being believed and being dismissed, and being not believed, being dismissed, dealing with apathy, and this perception of systemic bias among African American patients. So there were several areas where the trust in the system, or lack of trust in the system itself, colored how they felt about the AI tools. So if we can address if we can make the tool more trusted, again, being the doctor's helper or the provider's helper, then I think it goes a long way to not triggering the other trust issues that they have.
That's really helpful, and I think that that's the piece there where, again, it's that human centeredness, but also this idea that it's like almost trust needs to be won at every interaction. And I think of that where organizations are always thinking about that, right? Like how to get that, if there was something that didn't go well, how can I go outreach to that particular patient so that, things are addressed at the moment.
I do.
Oh, go
I'm
ahead.
sorry. I just want to add really quickly. I think I mentioned it before. Just talking about the use of AI in your practice, or at your hospital, or at your clinic, all goes a long way to establishing trust, right? Because if they don't know, if they're not being told that it's being used, then they're going to think it is, and then they're not being told, and that builds distrust.
Yeah, that's really helpful. And I wonder if this is a question that came up. Out of curiosity during the course of this, what examples came up where AI was already demonstrating improved patient outcomes, or better care, or a better relationship between the provider and the patient?
We heard a lot about the mammography and the 1,000 sets of eyes, right? Or we had given them some, that didn't come from the respondents, we gave them that, but we had given them some things that doctors say about AI, about how it helps them, and how it helps practitioners. And the respondents were very receptive to when the doctor said, this helps me, right? And the thing about having, being able to look at an X-ray, having 1,000 sets of eyes looking at the X-ray and not just the one human doctor, that was very relevant to a lot of people. They got it immediately, right? They got that one man can, or one woman can look at something for a very long time, but having 1,000 sets of eyes to help them was beneficial, not only to the practitioner, but also to the patient.
And that's really helpful for Michelle. I'm thinking of just in general how technology or other things, when it comes to the provider relationship with the patient, how they're also very they're very instrumental in how the messaging and the framing is shared. So not only thinking about how we're working on the patient education side, but also even maybe the provider education and clinical staff. There's a question here that I wanted to pose. Did patients seem to understand where to report an adverse event or concern relating to AI, which I think is very, it's an important operational question. So it's a good one to ask.
Yeah, I think that's a very important question, or an important workflow. It was not something that we asked directly, and it wasn't something that they brought up. But I think uh, the way that they framed it was like, can we opt out of tools if we begin to feel like it is no longer serves us?
And I think it did come up kind of tangentially with prior authorization. They were like, well, they understood that once they understood that the prior authorization would, would streamline them getting an answer quickly, and they very much valued that. But they were like, if the answer is no, what do I do? Because no human is telling me no. Like again, a robot is telling me no. So what do I do? So it did come up specifically in that instance. And there really, we didn't have an answer for them, but that concern came up in the, what do I do if I'm denied?
And I know we're coming up on time here, so maybe this last question, it may be related. It's looking ahead. How would organizations measure whether AI is truly helping patients, families, and caregivers to feel seen, safe, and supported? And I wonder if maybe that's a last thought as we begin to close this session out.
I think we should continue to monitor AI and have governance functions where we're thinking about how AI serves our providers and patients, where possible to do surveys and evaluations on the impact on our patient populations. And I think to invest in patient engagement and education that really supports this process. I think one thing that I thought about as we went through the Q&A and that didn't come up is there's a big focus on how providers can educate, but to the extent where we can also lean on our vendors to also provide support if, for companies who are doing regular consumer testing and learning, like where can they support, in customer success strategies and educating their buyers on how to best engage their providers and patients.
Yeah.
So I think we should monitor continuous surveying and then leaning on patient engagement and education.
Yeah, and I agree with that point. If there are metrics on some of these tools, like, this many, correct diagnoses were made or misdiagnoses were caught, or this many, authorizations were increased by, 32% over the last year. If there's metrics like that someone else is already measuring, we can use those metrics. That's what people were asking for, does it work?
Well, thank you so much again for the presentation, the content. We will make these slides available and the video recording as well following this. So I just want to say thank you so much to the team at Culture IQ. Thank you so much, Stella, for investing in this work. And so I'm going to pass it off to Wes to close us out.